The small drop in the death rate for some cancers is not good enough for Dr. David Agus of the USC Cancer Center.
I don't want to, put sour grapes on things, but it certainly, to me, is not a reason to cheer. I look at 2-3 people a week and say, I've got no more drugs to treat your cancer. I want dramatic effects where we can actually lower the incidence of cancer.
The war on cancer has not gone nearly as well as the fight against other illnesses. The death rate from heart disease is down 68% over the last 30 years. But the overall cancer death rate has fallen 12%. Dr. Harold Varmus, the director of the National Cancer Institute, says cancer should stop being viewed as just one disease.
We are dealing with many different diseases, all of which are called cancer. They have commonalities, but they also have many differences, and being able to make tremendous progress against all of them is difficult.
Each cancer has its own molecular blueprint. Successful treatment relies on finding a specific drug to target that cancer at an early stage. For example, since 1975, the death rate is down 71% for a type of leukemia because a new therapy was found. For colon cancer, it's down 44% because of early diagnosis with screening such as colonoscopy and better treatment. But for pancreatic cancer, there has been no improvement. Dr. Agus believes we need to concentrate more on prevention.
We know if you take a baby aspirin a day, there'll be a dramatic decrease in death across all cancers. We know if you get the HPV vaccine, you're going to have a dramatic decrease in cervical cancer death. We need to act on these things.
Doctor, he just mentioned the HPV vaccine. How effective is that, and are young women getting it?
It's very effective, and Scott, there was a special section devoted to this. It turns out that HPV, human papillomavirus, causes cancer of the cervix and also cancer of the head and neck. Now, there's an effective vaccine, in fact, 2 of them, that the CDC recommends for both boys and girls. But only about a third of girls are getting all 3 doses. You need 3 doses in order for it to be totally effective of that vaccine. So the National Cancer Institute said today, and Dr. Varma said to me specifically, there's a lot of room for improvement.
Only a third. Doctor, thanks very much.